Thank you so much, everybody. I'll try to be as quick as I can. Thank you for the introduction. So, Newham Nurture Program, I'd like to share with you about the program. We're in the London Borough of Newham, so we're in East London. We're a community partnership with NCT, which is National Childbirth Trust, and local grassroots charities, Alternative Trust East London, and the Magpie Project. So the program supports women and birthing people through pregnancy and up to 2 years after birth from low-income, migrant and marginalised backgrounds experiencing financial hardship and disadvantage. So we are a targeted service. All of the women we support are refugees or asylum seekers or have no recourse to public funds. Through the presentation, I'll be referring to women as this is how our beneficiaries self-identify. So Newham Nurture responds to well-documented inequalities in maternal and early childhood outcomes and barriers to accessing perinatal services for marginalised migrant women. So co-production is at the heart of all we do, and it's ongoing and it permeates through the service. On the screen, you can see this is just some of the words from our steering group. So the heart of the project is our co-production model to service delivery, which was adopted from the project's creation in February 2021 and ensures that the service is truly accessible, inclusive, and able to respond to the complex needs of the women that we support. So we have a steering group of women with lived experience of the hardships, challenges, and barriers that we've already heard much about that the new migrant families face and need to overcome when accessing maternity care. So the Newham Nurture approach aims to reduce every barrier stopping women from accessing maternity care and mitigating these through key practices within service delivery that really enable true access and inclusion for women and birthing people. So the service provides a real parent-centred, trauma-informed approach, enabling women to have their individual needs met, providing a safe, culturally sensitive and community space. Our co-led approach means that we're always able to be listening, learning, we're evolving, and we're improving the service to even better meet our target community's needs. We have quarterly focus groups to ensure clients' feedback and experiences are at the heart of the service and are fed into the steering group that provides co-leadership into the service design and the delivery. But a commitment to true co-production really works and takes significant effort, but through our experiences can also provide significant rewards, leading to really innovative new approaches in tackling inequalities and finding solutions. So our service offer, Newham Nurture provides specialist ESOL antenatal education bespoke to our women's situations. So providing evidence-based relevant information and increasing understanding of the UK maternity rights and maternity care. In reducing barriers to participation and mitigation, many of the challenges experienced by our women, we provide a healthy lunch, travel allowance for all sessions, interpreters, and offer CROAS facilities. We also help to resource families with baby care bundles, providing essentials, including Moses basket, hospital bag, clothing, and nappies. We provide postnatal baby and me groups with music, play, and parenting workshops, family support, peer support, and also trauma counselling. We've heard already some of the barriers that pregnant women in temporary accommodation experience. Additionally, women who are subject to immigration control through the asylum process or have no recourse to public funds, these barriers can be significantly increased. A family's experiences within the hostile environment can be distressing and disempowering, and fear and suspicion in accessing services can really be accentuated. So overwhelmingly, people seeking asylum have little information about their claim, systems in the UK, and services available. The level of support that they receive is often not enough to meet their essential needs or to provide for their children. Some of these barriers to health experienced during this perinatal period are, as we know, language barriers, Women not receiving adequate access to interpreters, therefore not able to understand when providing informed consent, and making it difficult to engage with maternity services and communicate any concerns and understand the care and guidance being provided by their midwife. We had one woman who never told her midwife that her planned cesarean section was actually the same day as she was evicted from her accommodation, as she didn't have any interpreter, and her last midwifery appointment, and there was no communication between social services and midwifery. So there wasn't a joined up approach. We see women unfamiliar with the UK maternity system, so not understanding how to access midwifery care and what support is available. This is causing a delay in registering when pregnant. Also, a lack of accessible, in-person, culturally appropriate and bespoke antenatal classes for women with English as an additional language. Of course, other than New and Nurture, which is what we provide. So we're seeing poor nutrition. We're regularly seeing high-risk pregnancies, food insecurity with pregnant women, and young children living on processed food, food bank provisions with a lack of fresh food and no cooking facilities. We're seeing long periods in hostels and hotels with no kitchen. Postnatally, women are formula feeding, who formula feed report not being able to clean and sterilise bottles properly, having no access to kitchens to wash bottles, or breastfeeding mums unable to express and store breast milk as they have no access to a fridge. Sofa surfing and frequently moving. Women are told by friends that their baby will be removed if midwives find out that they are homeless. Women are fearful of the Home Office, and when moving frequently, women miss appointment letters as they are sent to old addresses and may not even know that they have actually missed an appointment. Financial insecurity. As an asylum seeker, many individuals receive only £8.86 a week allowance, making it very difficult to travel to appointments or afford the essentials for themselves and for their baby. We're seeing a lack of childcare. Women who are socially isolated with no close friends or family have no safe childcare for older children to go during birth or healthcare appointments. A fear and suspicion of services. Many women who are subject to immigration control have a fear and a lack of trust in the NHS and maternity services. Some are declining care or interventions because they're afraid to receive a large expense that they're unable to afford. Many of our new mothers have received bills of up to £14,000 that they know they're unable to afford. Social stigma and discrimination. So negative stereotypes about migrant families and reducing leading to stress, racism, and also social isolation. And lastly, trauma and poor emotional and mental health. Women are holding significant psychological trauma from previous experiences and life events, many associated with experiences in their home country and while migrating. So the photo you see on the screen is of a hotel room sleeping one of our families of 5 people, including a 7-month-old baby. There are no cooking facilities or a food preparation area, which makes it difficult for the mother who is currently trying to introduce solid foods to her baby and trying to make the best healthy choices available within her circumstance. The family have been living in this hotel for over 2 years. And lastly, this slide is around a message that really we must be having a coordinated response to providing scaffolding for our families and finding sustainable and effective solutions to reducing inequalities. And it really must include the voices of experts by experience. So there's no need for us to be working alone. So New and Nurture are involved in numerous action and working groups locally, and also in ongoingly contributing to research and sharing our families' voices. When we're in meetings, asking ourselves, do we have all the perspectives that we actually need within this meeting? Is there decisions being made and voices that we're actually missing. Do we have NHS? Do we have local charities and lived experience? And it's important that we need to be creating respectful, honest, and safe spaces. When something is not working, we need to be brave and bold to be able to voice this when it's not working. Having clear, robust, and trusted pathways is absolutely imperative for professionals to know what support is available for families and the circumstances, how to refer, and having trust that the referral will be actioned and support will be provided. Some of the photos that you see here on the screen are from a key piece of work that we did locally to ensure that we had clear, robust, and trusted pathways that were also stress tested. Some of the solutions within some of the action groups we've come up with is around working collaboratively. We've seen a coordinated effort to resource and partner with local organisations and grassroots charities to create a food alliance, which has seen over 30 organisations providing access to community kitchens, regular hot meals, creating resources for safe preparation of formula and storing breast milk within hotels. Also, public health outreaching with organisations like New and Nurture to access women who are not receiving Healthy Start vitamins. And it's important that we can provide personalised support, providing healthcare and proactive support adapted to a woman's personal situation. This may mean letting her know that she needs 6 items when her baby is born and not the 20 items that are listed within the information booklet, or printing information if they don't have access to Wi-Fi, or adapting healthy eating advice and safe sleeping advice so it's achievable within temporary accommodation. But importantly, it's about scaffolding services around our families. Scaffolding is a temporary structure that provides a stable and strong support, which is what they need. And lastly, I end with a lovely photo of some of our staff and our partners and families of New and Nurture. And this is a photo that shows the award that we received from the maternity stream of Sanctuary. Thank you.